Carbon County Public Health and Riverstone Health are the public health agencies for Carbon and Yellowstone counties, located in south central Montana. This video has been prepared as part of a unified emergency medical countermeasures plan for both counties. The goal of public health is to improve life, health, and safety by preventing disease. Part of our job is to prepare for disasters that could impact our community, such as disease outbreaks, biological terrorist attacks, or natural disasters. A primary initiative of the Emergency Medical Countermeasures Plan is preparation for deployment of the Strategic National Stockpile, or SNS. The SNS is a cache of medication and supplies housed partly by the Centers for Disease Control and Prevention and partly by state health departments. The purpose of the SNS is to quickly get assets to local communities in the event of a widespread emergency. Carbon County Public Health and Riverstone Health are mandated by what is called the City's Readiness Initiative to be able to dispense SNS medication to our entire population in 48 hours. To do this, we have designated several points of dispensing, or pods, located at facilities around both counties. In order to staff each pod, we will need every available public health employee, as well as community partners. In this video, you will learn how SNS assets are to be dispensed. Keep in mind that if we activate the SNS plan, our community and our organizations will not be functioning as usual. Our number one goal will be to get medication to the public as quickly as possible. Time will be short, but we can accomplish our goal if we work together and plan together as a team. SNS deployment happens in several important steps. First, the community's need for drugs and medical supplies must exceed our local and state resources due to a catastrophic event or widespread disease outbreak. A chain of command is followed in requesting SNS assets. The request may start at the federal level or may come from the local public health agencies in the event of an isolated incident. In the latter case, the county health officers contact Disaster and Emergency Services, who contacts the state. The governor of Montana must declare a state of emergency and request the assets from the federal government. Once the decision is made, the Centers for Disease Control and Prevention deploy the SNS from a secret location. Assets arrive at the state receiving, staging, and storing warehouse within 12 hours. Assets are then divided and sent to the regional distribution sites in affected counties. The regional distribution sites separate the assets and drive them to the points of dispensing, where staff is standing by to receive, inventory, and dispense medication to the public. SNS activities from start to finish will run under the Incident Command System, or ICS. ICS is a standardized on-scene, all-hazard incident management approach. The ICS structure is flexible. Using management best practices, ICS helps to ensure the safety of responders and others, the achievement of tactical objectives, and the efficient use of resources. The overall SNS response will be overseen by an incident commander. Section chiefs will be assigned to oversee specific areas of response and may include finance, logistics, operations, and planning. The Operations Section Chief will report to the Incident Commander and is responsible for pod activities and oversees the pod managers. The pod managers oversee the unit leaders for each station, including start, registration, screening, treatment, pod flow, and support. A safety and security officer will also be assigned to each pod. One pod will have a public information officer and will be open to the media. Communications will flow from staff to unit leader to pod manager. Each staff person will receive just-in-time training from their supervisor prior to the pod opening. Here's a brief introduction to the members of pod leadership and their roles and responsibilities.
Hi, I'm the pod manager. My job is the entire operation of the point of dispensing, which is the pod. I'm also responsible for all formal communications to all of the unit leaders.
Hi, I'm the safety officer. It's my job to make sure that patients make it through the pod without accident or injury. In a widespread emergency, safety issues are bound to occur. I maintain close contact with law enforcement officials to ensure that criminal behavior is handled immediately. My staff and I also assess the pod ahead of time and do our best to mitigate hazards.
Hi, I'm the Public Information Officer. You will find me at the pod designated Open to the Media. It is my responsibility to communicate with the press and provide information to the public.
I'm the Greeter Start Unit Leader. I provide each person who enters the pod with a clipboard, pen, and patient history form. I direct people to fill out the form while standing in line. If they need assistance or help filling out the form, I direct them to the support station.
I'm the Pod Flow Unit Leader. I'm responsible for making sure that people move smoothly from one station to the next. I also help people that may slow down the flow of the pod to get to the support station.
I'm the Forms Registration Unit Leader. I am responsible for checking forms for completeness and accuracy before people go to the screening triage station.
I'm the Screening Triage Unit Leader. I am responsible for reviewing patient information and determining proper medications and dosages. I provide each person with instructions to give to the dispensing staff.
I am the Treatment Dispensing Unit Leader. I'm responsible for providing the appropriate medications to each person and sending them to the exit. I also provide instructions on how to take each medication.
I'm a Support Unit Leader. I'm here to assist people with special needs who may slow down pod flow. That may include people who are reading or hearing impaired, the physically disabled, pregnant women, families with small children, or people with psychological disorders.
Are you picking up medication for just the three of you?
A person entering the pod begins at the start station, where staff provide a form or multiple forms if necessary, a clipboard, and a pen. The person must fill out patient information for each person they are picking up medication for.
Any questions or concerns about filling this out? No. Okay, you can go ahead and process through there and go to the ladies in the yellow vest.
The patient fills out the form while moving through the line or may stop at a table.
Hi. Hello.
Once at the front of the line, the patient moves to the first available registration station.
Okay, I just need you to put your phone number and date this form, please. Okay.
The registration staff person checks the patient's form to make sure that all of the necessary information is filled in, including name, phone number, and address, and that all medical history questions are answered to the best of the patient's knowledge. Once forms are complete, the registration staff instructs the patient to wait for an available screening station.
You can take it to the screening table right behind you.
Okay, thank you. So you're picking up medication today for you and your two children, is that correct?
The screening staff person reviews the patient's form to determine the appropriate medication and dose using a pre-scripted algorithm. For children, doses are dependent on weight.
Dosage is determined by their weight. So I'm going to make a dosage chart out for each one of your children.
The screening station must be staffed with at least one medical professional. The screening staff person marks the appropriate treatment on the patient's form and instructs the patient to wait for the next available treatment station.
Instructions on how to mix it and how to give it to them.
Okay. Hi. How are you? Good. How are you?
The treatment staff person collects the patient's form and provides the medication based on the instructions provided by screening staff. The treatment staff person emphasizes to the patient that the first dose of medication should be taken as soon as possible after leaving the pod, and that all medication should be taken as prescribed.
This is the doxycycline medication for you.
Once medication, instructions, and a drug information sheet is provided, the treatment staff person will direct the patient to the exit.
Do you have any questions?
No.
All right, you can exit behind me.
All right, thank you.
The majority of patients presenting at the pod go through the 4 primary stations.
Hello. Hi. Someone needs help filling out the form? Okay.
However, there are those who require special assistance. People who might slow down normal pod flow are directed to the support station.
Marge, what is your date of birth? 10/18/71.
Support staff can accept patients from any pod station and must be able to assist with language and reading barriers, pregnancy or breastfeeding, emotional concerns and mental health issues, or any other functional need. Support staff meet the patient's needs, ensure forms are complete, and determine appropriate treatment, dispense the medication, and direct the patient to the exit.
Do you have any other questions for us?
No, I don't.
Okay, great. Well, thanks for coming today.
Bye-bye.
It takes a lot of people working together to effectively dispense medication to our entire community in 48 hours. From the time the medication arrives, it is Carbon County Public Health and Riverstone Health's responsibility. The public will be counting on us. Staff dedication and strict adherence to the incident command system are crucial to our success in protecting life, health, and safety in the event of a widespread emergency.